Hello guys, in today's video I'm going to talk about heart failure, right-sided heart failure, left-sided heart failure, some of its complications and then causes. After the blood has moved out of the heart and then gone to perform its activity in the body, it returns to the heart through the veins. And then in the veins, it passes through the inferior vena cava or the superior vena cava. So blood returning to the heart through our lower extremities passes through the inferior vena cava. And then the blood returning to the heart through from the upper extremities returns to the heart through the superior vena cava. Now, what you have to know is that first, blood from the inferior and then the superior vena cava enters the heart and comes into the right atrium. From the right atrium, it enters into the right ventricle. Blood returning to the right atrium, coming back into the right ventricle, it's deoxygenated. Now here, the ventricle of the right atrium contracts to pump the blood into the pulmonary artery. So the right ventricle pumps the blood into the pulmonary artery. The pulmonary artery will take the blood to the lungs. It will take the blood to the lungs for what? Oxygenation. Because the blood returning from either the lower extremities or the upper extremities are deprived of what? Oxygen. They are not having oxygen, so they are deoxygenated. So from the right atrium to the right ventricle, then the right ventricle will pump into the lungs for oxygenation. Now, after the blood has gone to the lungs for oxygenation, it will return back to the heart through the pulmonary vein. Now the pulmonary vein from the lungs through the pulmonary vein, it enters the left atrium. So the blood goes from the lungs through the pulmonary vein into the left atrium. From the left atrium, it passes through the valve and enters into the left ventricle. Now the left ventricle contracts to push blood through the aorta. And then from the aorta, it moves into circulation. So in simple, blood returning from the body, either the upper extremities or the lower extremities, return to the heart through the inferior vena cava or the superior vena cava. So first from the inferior or superior vena cava into the right atrium. From the right atrium, then into so it goes to the lungs for oxygenation. Now after the blood in the lungs has taken out oxygen, it then returns to the heart through the left atrium, passes through the pulmonary vein and then enters into the left atrium. From the lungs moves into the left atrium. From the left atrium back into the left ventricle. Then from the left ventricle, that is where the heart contracts at a high pressure to pump it into what? Circulation. Now, this is what causes right-sided heart failure and then left-sided heart failure. First, I'm starting with right-sided heart failure. In right-sided heart failure, we know this side of the heart is the right side of the heart. So in right-sided heart failure, that means there's either a blockage or a problem with the right side of the heart. So we all know the blood returning to the heart passes through either the inferior vena cava or the superior vena cava. When there is right-sided heart failure, the blood returning to the heart through the superior vena cava, it's moving from the upper part of the body. That's where you're going to see jugular vein distension because the right side of the heart is what? Failing. So there will be no way or there will be reduced blood flow for the blood returning to the heart. Okay. And then for the blood returning from our extremities to the right atrium. When there's right-sided heart failure, that's where you're going to see dependent edema. That's edema in the legs, because the blood returning from the lower extremities will back up into the body, because the blood returning from the inferior and returning from the body is passing through the inferior and the superior and the cava. So if it's returning from the body to the heart, and then the path that it's supposed to pass through is blocked, it will move back and then accumulate into the system. So in right-sided heart failure, that's where we have dependent edema in our lower extremities. Now, for left-sided heart failure, this part of the heart is the left side of the heart. So in left-sided heart failure, that means we have a problem with the left side of the heart. Now, we need that blood returning to the left part of the heart is returning from the lungs. So if there's left-sided heart failure, blood will back up into the lungs. Now, blood is moving through the direction, and then this part of the heart is filling. So the blood will back up into the lungs, and then it will cause pulmonary edema. During auscultation, you are going to hear a crackle sound because of the fluid accumulating in the lungs.